Thank you very much, John. I'll stand also on the existing protocols and bring you warm greetings from the President of the Republic of Ghana, Nana Addo Dankwa Akufo-Addo, who I have the honor to represent at this meeting. Exactly a year ago, I had the privilege to join in this meeting to form this August group, whose objectives align with the determination of Ghana to eliminate viral hepatitis. Ghana is obligated under relevant international conventions to ensure elimination of viral hepatitis. At our meeting last year, Ghana made a great commitment to work with all of you, and especially with the Arab Republic of Egypt, to accelerate the steps to eliminate hepatitis. In line with this, Ghana has elevated the status of the disease in the international health agenda and has continued working with various partners to scale up the response. In furtherance to its leadership, its partnership with Arab Republic of Egypt to assess high-quality treatment for hepatitis C, Ghana launched hepatitis C treatment programs under the Stop Hep C project. In a colorful ceremony in March 2023 in Accra, at which event both the Egyptian ambassador and Dr. John Ward were present, Egypt graciously donated 6,000 bottles of direct-acting antivirals in initial support of Ghana's first decentralized hepatitis C treatment program. And we are very thankful to you, sir. This intervention has brought much needed relief to hundreds of Ghanaians who have been diagnosed with the disease but were hitherto unable to access treatment. Many have completed treatment and many more are eager to start. The beauty of this experience is best described with testimonies of the ordinary Ghanaian who just had to walk from their homes to a district or to regional hospital to receive life-saving medicines for hepatitis C, free of charge. Ghana has learned a lot of useful lessons from this pilot, including the need to expand accessible, useful lessons to accessible point of care or laboratory testing for hepatitis. Ghana is currently using some of these lessons learned to fine-tune the next stages of implementation to ensure that more people benefit. On the World Hepatitis Day this year, the government decision to implement hepatitis B BEV dose next year was announced, much to the joy of the women and health professionals. This will come as a major boost for hepatitis B prevention and ensure reduction in the incidence of chronic hepatitis in the country. The Global Fund have also accepted Ghana's proposal for testing all pregnant women and treatment of those infected with hepatitis B as part of the triple elimination approach from next year. The fund is also supporting management of hepatitis and HIV co-infections in key populations. Government is ready to play its part in ensuring availability of trained, motivated health staff and quality infrastructure to implement the needed interventions across the country. Ghana is also aware of the Clinton Health Access Initiative and the Hepatitis Fund in assisting our countries to access to hepatitis medicines at much reduced prices. This opportunity and that opened by our mutual cooperation with Egypt promise to help the country overcome the hurdles that hepatitis case management pose to patients in our country. Ghana is therefore leveraging all these opportunities to eliminate viral hepatitis. As Ghana develops its primary healthcare structures with networks of practice across the country as its basic unit, and also the massive infrastructure development of 101 district hospitals across the country, the government will ensure availability of hepatitis care within all networks. In conclusion, ladies and gentlemen, it is worth noting the immense technical support of supranational organizations such as African CDC and WHO to viral hepatitis response in Ghana, Ghana would definitely take its pride of place in the global community for eliminating hepatitis. Thank you very much.